Hi, this is Dr. Donald Jervich. Today we're going to have a presentation on palliative care. This is brought to you by the Dakota Geriatrics Program, a geriatric workforce enhancement program sponsored by HRSA. The goals of this presentation are to look at the definition of palliative care, the processes, as well as the impact. A definition of palliative care might be a patient and family-centered approach to improve quality of life by preventing and treating suffering of those who experience a life-threatening terminal illness. What does palliative care do? It's a team approach that addresses physical, psychological, and spiritual needs of the person. It also helps facilitate autonomy and choice. It can bridge the transition to hospice. When to initiate palliative care depends on multiple considerations, but mostly when a serious illness occurs or a steady progression of an end-stage chronic condition, such as heart failure or chronic obstructive pulmonary disease. A lot of this is defined by activities of daily living dependency, as well as elements that observe on poor nutrition and weight loss. Also, supplementing your impression for palliative care would be abnormal vital signs or laboratory tests. So the question becomes when to initiate or revise an advanced care plan, and those allow us to define the goals and preferences for medical treatment and care. It also helps communicate the plan with family and providers. I always ask my patients, have you talked to your family members about your living will? You also want to document the advanced care plan. Many times people will have living wills, but do not have that documented in the medical record. And it's important to understand who the healthcare proxy is for the person. So the question is, how does palliative care as an entity support patient and family? Well, firstly, it's a team approach, and it helps with listening and communicating and further supporting decision-making processes. It helps bring focus to goals that are obtainable. It should strengthen coping skills of the patient and family members. It also will help facilitate conflict resolution when that occurs. It will also encourage completion of unfinished business, and it really provides a perspective of taking things one day at a time. Palliative care is coordinated care. It helps integrate curative, disease-modifying, and palliative care options, sometimes which are all occurring simultaneously. It also helps with symptom management, providing comfort, helping the patient meet goals. It may involve healing relationships, and at some point it may contribute to bereavement support. You might ask what the time points of communication might be. Of course, the initial diagnosis and prognosis of a limiting lifespan, and to discuss the trajectory of that disease process. And then also other points of communication include updates when there's a change in status, whether that occur through hospitalizations or transitions to long-term care, or perhaps even to hospice care. Might want to look at various terminal conditions and look at their trajectories as well as their palliative care needs. So cancer seems to be an obvious one, which might be a situation with short-term survival with widely metastatic disease. A lot of treatments for cancer now have really advanced the science and treatment of cancer. So it's not always a foregone conclusion that somebody is terminal when they have a diagnosis of cancer. But for those that do have advanced disease, it's important to understand pain control, exploring the option of hospice and preparing both the patient and family through palliative care. By contrast, chronic conditions such as heart failure and COPD are much more roller coaster events where you get acute exacerbations followed by a period of recovery. And these come and go, and overall the trajectory is one of a downhill decline. And knowing the point of the end-stage disease is when both palliative care and hospice would be appropriate. Neurodegenerative disorders are another consideration for palliative care. These involve typically a steady decline in function. So, for example, we know that Alzheimer's disease has a 10 to 12 year trajectory. That trajectory is accelerated by extrapyramidal symptoms such as Parkinson's syndrome. And so that person may have only 8 to 9 years of life expectancy. So we use a variety of tools to help predict those trajectories. One is called the Functional Assessment Tool, or the FAST, for Alzheimer's disease. And then for neurodegenerative disorders, we can use the Palliative Performance Scale. In terms of other conditions such as stroke or traumatic brain injury, these represent more sudden loss of function and can really have remarkable impacts on families in terms of their coping strategies. And so palliative care may be appropriate, particularly to help the family and patient understand that there's a 3-month window of initial recovery where about 60 to 80% of what is recoverable occurs, with smaller gains in functional recovery, whether it be cognition or physical improvements that occur over a 12-month period. So it's important for us to remember the spikes mnemonic. It's communicating bad news. We look at the S for setting, have a private place, have your information ready to share with the patient and the family. You also need to understand the perception. How does the patient see their illness? And then based on that, to have an invitation and to really understand from a provider's point of view how much the patient wants to know. K is for knowledge. This is to deliver information to the patient and family in non-technical terms. E is for emotion, allowing the patient to express their feelings and to acknowledge those feelings as a provider. And then finally, to summarize. In looking at prognosis, and we have a presentation on prognosis, it's valuable to use validated tools such as the Palliative Performance Scale that can be coupled to the Prognostat tool, which is developed out of Australia. In the United States, the ePrognosis calculator can be found on the internet, and it helps identify trajectories for many chronic conditions. There are also chronic disease calculators such as the Seattle Heart Failure Estimator, and then we've already mentioned for Alzheimer's dementia the use of the FAST scale. It's important to document things such as the advanced care plan. About 50% of patients generally have this documented in their medical record, and quite a few more may have advanced care plans and living wills, but they are not documented. It's important to establish who the durable power of attorney is and to always ask patients whether that information has changed. In terms of a POLST, or the physician orders for life-sustaining treatment, these are documents that are supported by each state on a state-by-state basis that provides information about whether the individual wants cardiopulmonary resuscitation versus a DNR status, do not resuscitate. And it also lists the level of medical interventions, whether they want just comfort care, limited care, or full care in case of an emergency. And then also addresses issues that the patient's preference for artificial feeding and hydration. So we know that the palliative care is impactful. It can help reduce costs in the acute care setting. There's some data that suggests that 80% of all Medicare costs go to the final year of life, which seems a little incredible. And so palliative care can be one way to alter the trajectory of both costs and then also quality of care. So we know that implementation of palliative care improves symptoms, reduces the symptom burden, reduces pain, and overall improves patient satisfaction. So to summarize, palliative care provides patient and family-centered options to relieve suffering from physical, psychosocial, and spiritual distress. It's impactful. It improves both the quality of care and reduces healthcare costs. It's important to utilize the mnemonic spikes when delivering bad news and to use prognostic tools to help patients and family members understand the trajectory of their condition. Thank you for your attention, and please visit the Dakota Geriatric website for additional presentations on geriatric topics.